Okay, I think we're back. I don't know if we were cut off for one of those questions, but one of the questions was, what kind of tests can you suggest for potential malabsorption that's available in the lab in Europe? So you're living in Europe and you're looking for tests to ask your doctor for that might suggest whether or not you have malabsorption. One would be fecal fat. It's a stool test. And your body's supposed to absorb 99% of fat. So if you have high amounts of fecal fat coming out, sometimes it's referred to as a steatocrit test, but this is a common test. Another one is pancreatic enzymes, and these are blood tests. This is a stool test, and these are blood tests. And pancreatic enzymes give you insight as to whether or not your pancreas is properly functioning. Your pancreas is responsible for helping you digest and absorb nutrients from the food that you eat, and also breaking your food down. So they're not perfect tests. They're part of kind of a scope of what we would like to see if we're trying to identify malabsorption. But those are ones that are available, should be available in Europe at a doctor's request if your doctor's open to running them. Let's go down in the middle. Been greatly affected by mold. I've been going to my moldy church trying to warn people, yet it falls on largely deaf ears. People don't want to know about it. I hate to say that, but mold is the reason I almost retired, because people don't want to hear it. And this is, the members of your church don't want to hear it. Your pastor probably doesn't want to hear it, because it means that expensive remediation needs to be done. But, it'll take somebody getting hurt or getting sick, or somebody that's making the decisions in that church to do something about it. I mean, if you've already told people, you're not going to convince them if they're not ready to be convinced. I guess you could share Mold Jack. That's our website on mold. And you could share that. There's a lot of video and blogs on what to look for and what mold can do to people. And it may be helpful, but outside of that, it's one of those, it's like the perfect storm of, people putting their head in the sand. How much vitamin C for a baby? Weaning, 12-month size, question mark. I don't know what you mean. So how much does a baby weigh? If you can give me that, I can give you kind of a better understanding. What to do about zinc upsetting the stomach? Tried with and without food, taking by itself. I've been taking for a few months. I mean, if it's really upsetting your stomach, the best thing is to stop taking it. You might also look at what kind of zinc you're taking. Some zinc products are different than others. Some have fillers, and it's not the zinc possibly upsetting your stomach. It's possibly the filler. I get this a lot with companies that use rice powder in their formulas, where people are using it and can't tolerate it when they're gluten sensitive. So I would look to any other kind of filler ingredient and determine that. If you haven't already, I would try maybe different brands. You should try the Gluten-Free Society brand and see. It's called Ultra Zinc, and see if you can tolerate that. And if you've tried it and you can't, you might just consider looking at high zinc foods as an option. What are symptoms that a woman may need estrogen? It's not about symptoms always. It can be. There are a number of symptoms. So, in a female, it could be lowered sex drive. It could be slow healing. It could be slow hair growth. It could be injuries after exercise that aren't being recoverable. If you're going through menopause, it could be severe symptoms of hot flash, mood swings, irritability, moments of even like psychotic behavior where you feel like you're not in control of your own mind. Those can all be symptoms of estrogen deficiency. Estrogen can contribute to bone loss if you don't have enough. Ultimately, those are all symptoms, but estrogen being low is not the only cause of those symptoms. And so you want to corroborate symptoms combined with good laboratory to determine, whether estrogen is necessary or needed. And so you can measure estrogen. There's a lot of different ways to measure it. You can measure it in the blood. You can measure it in the saliva. But ultimately, you want to measure at least your estradiol, and you want to measure something called total estrogen. And you want to measure something called SHBG, sex hormone binding globulin. Those are all important in the context of trying to get good understanding of your estrogen level. Is it okay to drink milk while following a gluten-free plan? Yes and no. It's a tricky question. We have whole hours of shows worth of why you should avoid, at least initially, dairy. If you're following no grain, no pain, avoid dairy for 6 months, the first 6 months. And why? Why are we doing this? Because the proteins in dairy, especially the casein, has molecular mimicry with gluten. So casein and gluten look a lot alike to the immune system. If the immune system's already hypersensitized to gluten, it's most likely going to be reacting to casein, right? So in that first 6 month period of time, what are we trying to do? We're trying to recycle the immune system. Your immune cells are brand new every 6 months. The circulating cells recycle every 6 months. And if we can go a full 6 months without dairy, we get all new immune cells that are circulating. And so now we can sometimes attempt to reintroduce some dairy, possibly. This doesn't always work out very well, but it can. If we do introduce dairy, it's only A2. A2 casein is a lot safer of an option. If it's not A2 dairy, you shouldn't try to reintroduce it. I do not recommend standard A1 dairy in anyone with gluten sensitivity, but A2 is a possibility. They have to consider something else as well. Many people with a history of gluten sensitivity, it's approximately, research-based, is approximately half. So about 1/2 of all gluten-sensitive individuals have lactose problems, lactose intolerance. And it's because of the damage to the intestinal lining where lactase is produced. Lactase is the enzyme that breaks down the sugar in milk called lactose. So this is not an allergy, this is an intolerance. It's the inability to digest. So people that have gluten sensitivity with extensive gut damage that are not making adequate amounts of lactase don't do well on dairy, not necessarily because they're allergic to it, but because they're not able to digest the dairy sugar. We actually have a supplemental called Dairy Shield, and it has the array of enzyme that breaks down lactose for those of you who are just trying to introduce some A2 milk, but maybe you don't tolerate it because of the intolerance, but not because of the immune response. It's a complicated question, and there are ways to measure all these things. And that's typically what we do in the clinic when we're trying to take care of somebody, is we try to measure so that we can get better determination of how they need to go. But hopefully that gives you some context. You can also peruse some of our shows on dairy. We've got probably 4 or 5 hours of shows on dairy specifically that you can do a deeper dive in. Best way to test for mold. There's no best way. There are best ways to test for mold. Best ways, very important, because there's no smoking gun one way. When you're thinking about mold, it's complex. It's complex for many reasons. So how do we look at testing for mold? Number one, we look to physical clues. What does that mean? Physical clues would be around the house. So one thing you want to check is your relative humidity in your house. Most of you have a digital thermostat. What does that number say on humidity? If that number is higher than 55%, okay, we got a potential problem. That's too much moisture in a home. So you look at that. That's a physical clue that we can measure. If you don't have a digital thermostat, you can buy one on Amazon. Not a thermostat, but you can buy what's called a hygrometer for about $6, $7. They're not real expensive, but you can buy one of these and you can place it in your home at any area in your home, and it'll measure the relative humidity for you, so you can get a good idea of where humidity could be high. Where a lot of times where we'll see this is a problem is in the bathroom. So that, again, physical clue. if there's a history in the home of water damage, roof leaks, pipe bursts, major floods, any major water event would be like a red flag, big time red flag. And this is like down here where I live, Hurricane Alley, you get homes that flood. If they're not properly remediated, if the water's not properly dried out, you repair them and you lock that moisture inside the wall, and you're going to get mold that's hidden. Now, if you do, so we always look to the physical in terms of the house. One of the other areas you should always have checked immediately if you suspect mold is your HVAC. A lot of times it's growing on the coils or it's in the plenum. And so that should be looked at. It should be checked. Twice a year, you should check your HVAC. You should have somebody do the checking. And if they see microbial growth, you need to explore that with all of the aggression of that your life is at stake if you don't figure it out. Very important. And then, of course, if you smell must, that's mold. So these are things that we would take into context just at home, right? On the surface without spending a lot of money on mold inspections. Now, we're talking about human testing. So in the person, we're going to look at several things. We're going to look at mycotoxins in the urine. We can possibly also look at mycotoxins in the blood, but not specifically mycotoxins in the blood, antibodies that you might be producing. So antibodies against the toxins. That's an insight or a clue. There are other tests that we can also look at. We can look at antibodies to molds. So molds and mycotoxins aren't the same thing. Mycotoxins are the poop of mold, if you will, and then the mold itself. So you can be reacting to the mold, but you can also be reacting to the toxins that the mold produces. So these are three separate types of tests that give some clinical insight. There are other tests as well. There's tests like transforming growth factor beta 1, which is an indirect marker for inflammation that's commonly found in people that are being exposed to mold. But you have to be careful about this kind of test because it can also be high if you have Lyme disease. It can also be high if you have gluten sensitivity and you're eating gluten and you didn't know you were gluten sensitive. So gluten can actually elevate TGF beta 1. There's other compounds that can also be measured. C4A is an inflammatory marker that's sometimes elevated in mold. And then there's MMP9 that can be elevated. Ferritin, in my experience, ferritin is one of the cheapest common labs that a person can measure. And it's very common that people that have mold in the background have elevated levels of ferritin. It's not always true, but again, it's indirect. And so ferritin elevation has other meanings, not just mold, but these tests are non-specific. These tests are more specific. And I always like to start with very specific tests because I don't want to go after potential question marks. I want to go after you have the toxin coming out of you, or you are making the antibody to the toxins, therefore you're being exposed, or you're making antibodies to the mold, therefore you're being exposed. So where I would probably start in anyone would be here first in these three areas or arenas if I'm really trying to dial in whether or not there's major mold exposure. Now, beyond that, we don't just look at testing, but that was the question. What tests do you recommend? We also really focus heavily on symptoms, because symptoms combined with testing, combined with physical data from the home are they kind of paint the picture, if you will. Think of all these things as different puzzle pieces, and we're trying to put together a comprehensive picture. And why do we look at all these things? Why is it important to measure all of these things and not just one of these things and then take it out of context? It's because of what that commenter said earlier, which is I'm trying to convince people at my church that there's a mold problem and no one will listen. When you're trying to identify mold, the biggest challenge is convincing the person that's in mold that they need to recognize that they're in mold. People don't want to hear it. Why? Because instantly in their mind, they're already overwhelmed. They already feel sick. Now they're thinking, well, if I move, where am I going to move into more mold? Or they're thinking, how can I afford this? It's very expensive. I can't afford a new air conditioning unit to replace the one that has mold in it. Or they're just thinking in terms of dollars, and they're not thinking in terms of their long-term health usually, or they're just not thinking very well at all because their brain is being poisoned by mold. And I get it. I've been there. I lost a house to mold. I lost a dog to mold. Any of you that know my story around mold, you can go to Mold Jack and you can learn more about it if you'd like. But I know mold and I know the psychology of mold. And if you don't paint an objective picture, then you could die in that mold. And I've lost patients in mold because they refused to acknowledge that it was part of what was creating their problem. They just didn't want to admit it. And they did everything else and danced around it, but didn't want to admit it. So you've got to be super objective when it comes to trying to identify mold as a piece of the puzzle. I know that was maybe more of an answer than what you wanted. Had an abdominal hysterectomy 2 weeks ago, and the 7th post-op day had SIBO and now healing on gut and the surgery. Need guidance on gut healing from the negative and the surgical. Have been your follower since my diagnosis, Hashimoto in 2020. So if you're already following No Grain, No Pain, that's the first step. Did you watch Kalapi? Did you watch my class, my surgical class? I mean, a lot of your answers are going to be there. Post-hysterectomy, you want to be on my post-surgery protocol to support your healing and your recovery. It's going to be one of the most important things. You got to give your body the support it needs to repair. I mean, that's where I would start. I mean, outside of that, you can reach out to my office. Certainly, we can put that information up for you. And if you want to do that, I can give you better specificity. What would I use for someone who had a stroke? I want to know why they had a stroke. What was the driving force behind why they had it? It's a funny thing. By the time the stroke happens, the damage accumulated over many years, right? And it's a vascular problem typically. And but we still want to reverse engineer the behavior that led to the problem because we want to change that behavior. But acutely, immediately post-stroke, what's the number one supplement that you should look at for recovering, supporting that recovery? Number one is a strong omega-3. I have something called Omega Max that I use, and we use 6 to 8 caps a day in post-stroke. That's what we use in the practice for people that have had that type of problem. So this is one of the elements. Now, depending on, sometimes patients come to me, their doctors have them on, the other doctors have them on other medications like blood thinners and things of that nature. So there's the context around all that. I also would want to take a lot of those other types of things into consideration, because if they're on a lot of blood thinners already, this might be too high of a dose. Or it might need to be monitored closely if they're also on a blood thinner, which is typically what I would do. Is I and their other doctor would work together typically to monitor their blood viscosity to make sure that we're not getting their blood overly thin. Because why do we want this much? Because this one, it's got anti-inflammatory properties. But the other reason why we want it is it's going to improve blood flow to those areas that had ischemia. And when you had blood loss to a certain area caused by a stroke, the ischemia, which is the oxidative damage that's caused as a consequence of that reduced blood, that inflammation does damage to the tissue. This can help get nutrients and flow into that area much more quickly. And so the outcomes are better. And there's a lot of research in this. As a matter of fact, when the doctors originally researched this, was an ex-Army medical doctor who was researching trauma and injury and concussion injury in soldiers, and they were using high doses of fish oil. And he's really who brought a lot of this research to light. How do you support your body before, after a CT scan with contrast? If I had somebody, in my practice, it was like, okay, I just had a contrast. What do I need to do next? I'd put them on something called Ultra Metal Detox, which is a nutritional chelating support supplement. And what it can help do is it can help support the body's ability to get that stuff out. which is what we want. Ultimately, we want those metals out, because usually those dyes, those contrast dyes, are metals. Can we rewatch the lives like this one? Yeah, everything that we've ever done is on our channel, right? So if you go to the Dr. Osborne channel, you can rewatch any of our lives from the historical past. We don't gatekeep those things. It's all there. It's all available for free for anyone who so deems to want to dive into this rabbit hole of nutrition. What could someone do for a bariatric gone terribly wrong, resulting in removal of stomach and small intestine? Get a good lawyer. But I mean, in all earnestness, this isn't a YouTube question. This is a, this is a person that needs to get immediate help. I mean, she can reach out to my office, but that's a very complicated scenario. And I know you're trying to tell me what happened, but there's probably a lot of devil in the detail, and what she does and doesn't have left in terms of digestive organs. And those things matter most from the perspective of a doctor like myself trying to help get somebody well nourished after they've had chunks of their digestive tract removed from a botched surgery. So get her help professionally, and you give her my number. But it's not a simple do this. How to determine what causes blood in the stool. Besides, I'm allergic to wheat and sensitive to almonds, and that makes me bloody stools. When I take away those two items, I still have bloody stools. You got to go deeper. I mean, if you're allergic to wheat, are you also gluten sensitive? Are you eating other grains? I mean, there's what can cause damage to the gut that would lead to blood in the stool. Lots of things. Food, chemicals in the food, certain prescription drugs, including over-the-counter drugs as well, that can cause erosion in the stomach that lead to blood in the stool, or erosion in the intestine, mucosally. Microbes. A number of different microbes. C. diff is a common infection of the lower intestine that can lead to bleeding in the stool and blood in the stool. Hemorrhoids are a potential possibility. If your gut motility is off and you're constipated more frequently, you can get blood in your stool as a result of internal hemorrhoids that aren't obvious. So I mean, there's a laundry list of things. You just got to work with somebody who knows what they're doing that can guide you down the right procedural diagnostic. So if you're trying to get testing from Gluten-Free Society and you're trying to find a place to get your blood drawn, call my customer support team. They can lead you to lab locations all over the country that can help get your blood drawn. But Lab and Quest won't draw it, because the Quest and LabCorp, they'll only draw tests from Quest and LabCorp. So we have independent locations set up all over the country that you just reach out to customer service and they can answer that for you. How do I get mycotoxins out of my sinuses? Itraconazole is not working. Well, itraconazole is not for mycotoxins. Itraconazole, people get really confused about this. Itraconazole treats mold or yeast that's growing in you. So let's say if in your sinus cavities you have a yeast or a mold growing in your sinuses, right? Then itraconazole would kill the mold or the yeast. Itraconazole does not get rid of mycotoxins, because mycotoxins aren't mold or yeast. Mycotoxins are mold and yeast poop. So we go back to what I said earlier. If you're treating the sinus, because probably your doctor thinks you have a mold sinus infection, and so they're trying to kill the mold. They kill the mold in your sinuses, it's going to reduce the mycotoxins because you no longer have a mycotoxin factory. Remember, molds make the mycotoxins. So you do have to confirm that you have a mold infection and treat the mold infection and get rid of it, in which case you'll quit making them. But then after you're done and that's treated, they're still there. There's still mycotoxins that can stay in the body. And this is what oftentimes is referred to as detox, right? Well, now, once you get the mold out of you, once you get the mold out of your house, now you have to get the mycotoxins that are pervasively stuck in your body out of your body. And this is the process of detox. And itraconazole will not get mycotoxins out. It will stop the yeast or the mold that's producing them, that's growing in your body, but it won't get the ones that are still persistently in your body out of your body. That requires, in my opinion, that requires binders. That also requires liver support so that you can bind these toxins and support your liver's ability to water solubilize them so that you can expel them out of the body. Apart from diet change, what are the supplements that can help someone with mild Parkinson's with tremors? I mean, if you've got neurological problems, I'd start with B vitamins in high doses. And with Parkinson's specifically, I'd start with high doses of vitamin B1. But even more than that, random supplementation's a guess. Test, don't guess. So do an INA. Did we put a link up to that, Mel? To the INA? We did. Yeah, look in the commentary. We put a link up to INA testing. And that now you can get really customized with supplemental support. How many vials of blood do we draw? So for the nutrition testing, we only need one, but we usually draw two just in case we need it. The same is true of our food sensitivity test. So maximum 4 vials for those two for each test. Best diet for myasthenia gravis? No grain, no pain. Eric, no grain, no pain. Best diet for fill in the name of the disease that's autoimmune in nature? The answer is always going to be no grain, no pain. Start there first. How best to test for my, okay, I think I answered that one. Thank God, okay, yeah. Okay. Can those in the UK order your INA test? They can if they do remote consultation with me. So you'd have to set up that through Origins. And if you're interested in doing that, you just reach out to my office. I think we've got the phone number. We put the phone number up. Yep. So just reach out. We can do it overseas only in that situation, but we can't do it if you're not a client in the office. My husband died. I'm sorry that you went through that. My husband died subnuclear palsy coupled with frontotemporal lobe dementia. Awful. I'm learning to care for myself, and I need to get better at caring. And more of a comment. I hate that you're going through that. Okay. Well, man, we've gone, what's the time go? 2 hours in. So, look, I hope today's show was helpful. I hope you learned something. If you did, do me a favor, hit that like button and hit that subscribe button. If you do, you'll get notified when we go live. We do this every week. Also, come visit me at Gluten Free Society. Sign up there for our newsletter. Our newsletter will send you a bunch of free information about how to navigate autoimmune disease with diet and lifestyle change. No cost, just good information to help you start moving in the right direction. If you want Tuesday show on surgery, if you want those notes on the surgical protocol and you want those surgical protocols, you can click the link that we put in. But if you're not on YouTube, you just comment surgery and we'll send that to you. And don't forget, right now, if you want to do lab testing, it's 15% off. Take advantage of that. That sale goes through Monday. Use code LOVE15. And we also have a site-wide sale on supplements. We have over 100 different products in the supplement realm. So if you're looking for high-quality pharmaceutical-grade gluten, grain-free products to support your healthy needs, use code LOVE10 and you can save 10% off right now. So don't forget to take advantage of those savings. Again, appreciate you guys, appreciate you tuning in each week, and appreciate those of you who are new, and hopefully, like I said, you learn something and you stick around and you get the help that you need. Thanks so much. We'll see you on Tuesday night for another crash course. Have a great Valentine's Day.